My name is Minie-A'a Peruk. I'm a nurse from the Inuit Health Center in Puvanituk. I've been working here for as long as I've been a nurse. I grew up in Gradewell, which is also known as Kudrapik. I'm 59 years old.
What made you decide to go to school to become a nurse?
It's a weird and long story. There was a nurse who came from Great Britain and England. Her name was Miss Lutley, Marie. She was there for probably 20 years, and we got close. And when the federal government started sending students to Churchill, Manitoba, she wanted me to go. So she got the Anglican minister behind her because my parents didn't want to let me go. She finally said, I'll pay you $25 a month to let Minnie go to Churchill, and my mother let me go for $25. I tried to go into nursing as soon as I finished my high school grades, and people, I should say, white people were not ready for that, for me. So I quit nursing school when I had only 6 months to go. And I didn't heal from it for 20 years, and I went back after 20 years.
What was it about nursing that attracted you at such a young age?
Helping my own people. Miss Lutley made the wheels start moving around in there. I saw her helping a lot of people, and that really attracted me. Like she helped my mother, because my mother could never have children that stayed alive. I have 3 brothers and 3 sisters. They all died, and I saw the nurse really helping her.
Were there other Inuit nurses in your community when you were growing up?
No. The first time I went to school was the first year there was a school in Gradewell. So there were no Inuit nurses at all. There were nobody with any profession.
You talked about that when you first went to nursing school that white people weren't ready for you. So was it a bad experience at that time?
You don't know how bad, and probably nobody will ever know how bad it was.
What was it that finally made you go back and get your schooling, finish it, and become a nurse 16 years ago?
We had been living in Yellowknife. There's no nursing schools there. And when we moved to Timmins, I realized there was a nursing school there. And I kept applying for RN, and they kept rejecting me, but I kept applying every fall, September. Finally, when I applied for RNA, they took me in, and I transferred to the registered nurse class later.
What was the nursing school experience for you like the second time around?
Nearly the same. But this time I was much more grown up, much more mature, and harder in my heart.
So you were able to push through everything?
I think I was second in class when we graduated. I was thinking about my other old class, thinking, what would they say if they saw me now?
Once you started seeing patients, what was the reaction of the community? Puvanituk is predominantly Inuit. Mm-hmm. What was the reaction like when you walked into a room?
Okay. One of the first patients I had, he was in a wheelchair. And I came in with my little cup full of medication, and he was staring at me like, why are you giving me medication? Inuit don't give me medication. The nurses give me medication. So I explained to him, I am a nurse. And then he listened for a while about my going on about how I am a nurse. Then, without saying anything more, he was really going like, we're in charge in here.
What's the reaction like now when you walk into a room?
I'm hoping they're proud. It took a long time to get used to it. It took a long time for me to get used to it and for them to get used to me.
What do you think are the main challenges of delivering health care in the North?
It's the great distances and the turnover. It's really incredible. The turnover is incredible. We're a long way from somewhere people perceive to be important. And here in Quebec, it's languages. Everybody doesn't speak the same language. So some of the messages get really twisted, and that can impact the health of the people who are the consumers of healthcare. Challenges also, again, related to language. When I'm translating all the teaching materials, it's very hard to translate medical terminology into Inuktitut. The other challenge was that because the Inuit, they see it macro, not micro, so they don't understand germs, or they don't understand your blood circulating in your body. It's hard to explain to them that there's something wrong with their body, with like diabetes, when they don't feel sick. When somebody gets sick in the south, they do blood work to see what is wrong with you, and they do an interview on you. And when you're doing that on an Inuit person, they don't necessarily understand why you're doing that. They don't necessarily understand why you're interviewing them. Some of them, I think, they just think you're visiting with them. So it's hard.
Are the health concerns that people bring to you, are they different now than they were when you started?
From my point of view, related to diabetes, obesity, it rose. There's no lack of food now. People don't know which foods are good choices. White people have food eating schedules, breakfast, lunch, and supper. Inuit don't have that. They eat whenever. And whenever there's food available, too.
And does that affect health even nowadays?
Especially for the person who is pre-diabetic and their body is struggling to control their blood sugar. Yes, very much.
We've been hearing in the other Arctic regions as well that health systems are based on the southern Kalanut way of doing things and doesn't take into account Inuit culture. Mm-hmm. And I'm curious if you've seen this either as a nurse or as someone living and working in the North.
It's very frustrating on both sides because the nurses are expecting the reaction to be the same as in the South, and it is not. The nurse gets frustrated because the Inuit sometimes does not follow the nurse's instructions because maybe he didn't understand, maybe his culture doesn't do that or it's not a normal thing to do in the Inuit culture. But the nurse wants them to do it so they can be healthy again, but they're working against each other. There needs to be, way back down south before they hire them, there needs to be cultural orientation. There needs to be someone down there saying, this is what you're going to encounter, these are the people, and this is from someone who knows what they're talking about.
What do you think needs to be done to have more nurses actually from the communities working in the north?
People like you trying to get the story out that we need them. Teachers and people who are in charge of education really pushing. It's a really good experience to be a nurse. You get more than you give. You're saving lives. So it's when you see a person get better, it's why you became a nurse. When you see them get better.
Do you consider yourself a role model?
No, and I don't want to be, really. I feel like I don't qualify.